When you come to HRC Fertility in Newport Beach for the first time, I mean, what you should expect is that you will have a very pleasant and thorough experience.
We are very hands-on with patients. We work as a team, and we really try to promote the best technologies for each individual patient and what they need.
Each couple comes and meets with their physician, which manages their care, working with their nurse coordinator, which is there every step of the way. Every decision is made by their physician. All the procedures are performed by their physician, and they're intimately involved with their care from start to finish.
HRC offers the entire range of fertility treatment. Among them is ovulation induction with different types of medications, intrauterine insemination, in vitro fertilization, intracytoplasmic sperm injections, as well as the entire spectrum of fertility surgery.
The advantage of having one center that offers comprehensive services means that patients will not have to travel between different locations to receive their ultrasounds, their blood tests, their egg retrievals, or their embryo transfers. The fact that everything is done in-house means that we have quality control over all aspects of their care.
We feel that it's important to spread the word that we are a successful group, and that I've treated a lot of patients who were told they couldn't get pregnant and that their odds were very, very low. And with some very simple tools and techniques, I've been able to get them pregnant. A lot of my couples where the intended mom is over 40, and maybe she has tried numerous attempts at her own egg and has had a very poor response. Those are the couples that I would consider for egg donation.
Using a donor from a young, healthy patient enables these women to accomplish a pregnancy with a very high success rate.
Surrogacy involves the use of a third party to carry the baby when the intended parents are not able to provide this either through medical conditions that the woman may have.
HRC Fertility has the largest gestational carrier surrogacy program in the world. So we do more cases of gestational carrier surrogacy than any other practice. Pre-implantation genetic diagnosis is a process where we create embryos with in vitro fertilization, and then we are able to remove a cell from the embryo. When the embryo reaches the multi-cell stage, we can remove a cell from the embryo without harming the embryo, and we can actually test that cell.
The advantages PGD offers patients is that they're able to determine the genetics of the embryo before the embryo implants and produces the pregnancy. This dramatically lowers the risk of miscarriage and will determine whether the embryo has such common genetic conditions like Down syndrome.
All of us here have been practicing for a long time. We've gone through programs that are very competitive. A lot of us are working in areas of research in reproductive medicine. A lot of us have published in the area of reproductive medicine. And a lot of us, we actually teach and train our colleagues. We also try to make it a team approach. So I have a financial coordinator who talks to my couples. I have a nurse coordinator who will describe what the process is like. And they're all part of my team at the initial consult. I even have a patient concierge here.
I'm very proud to say that our lab is very unique. I think it's one of the best in the United States. What you're seeing behind us, we have the best incubators, the best air quality. Anything that's in the field new and proven to be good, we have it.
Shortly after I completed my fertility training, my wife and myself decided that it was time for us to start a family. Turns out that we had fertility problems. I think that in the end, it served a purpose, and that purpose was to prepare me to help other people and to understand, how they feel and what they're going through.
My favorite part of being a reproductive endocrinologist is that we actually change patients' lives for generations to come.
Really the greatest satisfaction is when the patients come in and bring their kids.
I think that what really keeps me going is the fact that a lot of people actually get pregnant. So I see my successes all the time.
The reason why patients should choose HRC Fertility is because at HRC Fertility, we care.